Today, we're diving into the critical topic of oxygen imbalances and how they affect our bodies. First up is hypoxia, which isn't a disease itself, but rather a deficiency of oxygen in our tissues, or the inability of those tissues to properly use oxygen. It's often a consequence of respiratory illnesses. There are several types of hypoxia, each with a different cause. Hypoxemic hypoxia occurs when there's a low arterial partial pressure of oxygen, usually due to inadequate pulmonary gas exchange. This can happen at high altitudes where there's less oxygen in the atmosphere, or from impaired ventilation, respiratory arrest, degenerative lung diseases, and even carbon monoxide poisoning. Next, we have ischemic hypoxia, also known as circulatory or stagnant hypoxia. This results from inadequate blood circulation, such as what you'd see in congestive heart failure or blood clots. Then there's anemic hypoxia, which is caused by anemia and the blood's inability to carry enough oxygen. Finally, histotoxic hypoxia occurs when tissues can't use the oxygen delivered to them, even if there's enough. This can be caused by metabolic poisons like cyanide. Hypoxia is often visible as cyanosis, a bluish discoloration of the skin, but too much oxygen can also be dangerous, generating harmful free radicals that damage tissues and can lead to serious complications like seizures, coma, or even death. Beyond oxygen levels, our respiratory rhythm can also vary significantly. Apnea is a temporary cessation of breathing, even just one or more skipped breaths. Dyspnea is labored, gasping breathing, or shortness of breath. Hyperpnea is an increased rate and depth of breathing, often in response to exercise or pain. Hyperventilation is increased pulmonary ventilation beyond metabolic demand, frequently linked to anxiety. It expels carbon dioxide faster than it's produced, lowering blood CO2 and raising blood pH. Hypoventilation is reduced pulmonary ventilation, leading to an increase in blood CO2 if it's not expelled fast enough. Kussmaul respiration is deep, rapid breathing, often seen with acidosis, like in diabetes mellitus. Orthopnea is dyspnea that occurs when lying down, improving when sitting or standing upright, and is seen in conditions like heart failure or asthma. Respiratory arrest is the permanent cessation of breathing without medical intervention. And finally, tachypnea is simply accelerated respiration,